So obviously when there are, a number of lesions and it's not possible to, basically treat every single lesion, then the idea of using radiation in this setting is to help with symptoms or to prevent potential problems. So one of the things is obviously if there's a painful bony metastasis, then radiation is very effective in terms of relieving the pain. And I guess it works by, obviously treating that area, shrinking the tumour down in that area, and that's partly how the pain is relieved. It can also be used for bone mets if it's in a location where you know that if that metastasis progresses, it could actually cause problems by weakening the bone and putting someone at a risk of fracture. So if it's in a weight-bearing long bone, then sometimes we treat even when there's not too many symptoms from it, but because we know that if it progresses at that site, it could become a big problem. And so it can be more as then in that case preventative. There is also now probably a school of thinking that's coming along where you can use radiation in a very targeted sort of fashion. So this is what we call stereotactic radiation, and we can really focus in on a lesion, so long as it's safe to do so, and we can give much bigger doses, but only a few treatments, but very, very focused. And that can also be used for some bony lesions, for example, or even other metastases. And I guess that is much more, perhaps aimed at trying to eradicate the disease, perhaps in that site. And there's now sort of some evidence that if you do something like that, give a really big dose, cause like death in that area, that can sometimes cause release of things that sometimes triggers a response in other, it causes some sort of immune response in some of the other lesions as well, or may help other immune, sort of mediated agents work a bit better. You can offer retreatments. It's partly limited by how much you had the first time around. It's partly limited by what is around that area, because sometimes some of the tissues that are around are going to be a little bit more sensitive to being damaged, so that those tissues might be what's restricting how much you can give. It really just depends on the circumstance, but overall you can, at least it can be considered. It's not necessarily an automatic, I've had treatment before here, I can't have any more.